Have you ever wondered what barbiturates are and how they affect the human body? Well, let's take a journey together to explore this intriguing topic. Barbiturates are a class of drugs that were once widely used in the medical community. They fall under a broader category known as central nervous system depressants, which, as the name suggests, slow down the body's functions. Imagine your body as a bustling city. In the midst of the hustle and bustle, barbiturates are like the traffic lights, slowing down the rush and bringing a sense of calm. They achieve this by increasing the activity of a neurotransmitter in our brains called GABA, which helps to produce a calming effect. Barbiturates were first introduced in the early 20th century and were commonly used for a variety of medical purposes. They were prescribed for conditions such as insomnia and anxiety, and were even utilized for their anti-convulsant properties in the treatment of conditions like epilepsy. However, despite their widespread use, these drugs had a dark side. They were highly addictive and carried a high risk of overdose. Too much of these drugs could cause a person's bustling city, their body, to slow down to a complete standstill. Due to these risks, the use of barbiturates has drastically reduced in recent years. They've largely been replaced by safer alternatives like benzodiazepines. Yet, even though their use is less common today, it's still important to understand what they are and how they work. After all, knowledge is power, and understanding the intricacies of these drugs can help us make informed decisions about our health. In the coming segments, we will delve deeper into the history, uses, effects, dangers, and the future of barbiturates. We'll explore how they've shaped the field of medicine and how they continue to influence it, even today. So let's dive deeper into the fascinating world of barbiturates. To truly understand barbiturates, we need to take a step back in time. The story of barbiturates begins in the early 20th century. They were first synthesized in 1903 by two German chemists, Emil Fischer and Joseph von Mering. Their creation was lauded as a scientific marvel. Here was a drug that could induce sleep, relieve anxiety, and even treat epilepsy. The first barbiturate to be used in medicine, barbital, was introduced in 1904, and it was as if a new era in medicine had dawned. Throughout the 1920s and 1930s, barbiturates gained popularity. They were prescribed for a wide range of ailments, from insomnia to anxiety disorders. In the 1940s, they were used as a standard treatment for anxiety and insomnia. They were seen as a miracle drug, a panacea for a host of ailments. The idea of a pill that could whisk away worries and lull you to sleep was highly appealing. But the 1950s brought a shift in perception. Reports started to emerge of people becoming dependent on these miracle drugs. The addictive nature of barbiturates began to reveal itself. Overdoses became increasingly common, often with fatal consequences. The very drug that had been hailed as a miracle was now seen as a potential killer. Throughout the 1960s and 1970s, the dangers of barbiturates became more widely recognized. The medical community started to pull back, prescribing them less frequently. Newer, safer alternatives were introduced. By the 1980s, the use of barbiturates had sharply declined. They were no longer the go-to solution for sleep and anxiety disorders. Instead, they were seen as a last resort, to be used only when other treatments had failed. The history of barbiturates is a cautionary tale. It's a story of a drug that promised so much, only to reveal a dangerous underbelly. It's a reminder of the importance of thorough testing and cautious optimism in the world of medicine. As it turned out, barbiturates had a dark side that wasn't initially apparent. Despite their risks, barbiturates have had numerous medical applications. They've been a key player in the world of medicine, being used to treat a variety of conditions, each with its own unique set of challenges. One of the most common uses of barbiturates is in the treatment of insomnia. These drugs were often prescribed to help patients fall asleep and stay asleep. They work by depressing the central nervous system, slowing brain activity, and promoting a sense of calm and relaxation. For patients struggling with persistent sleeplessness, barbiturates provided a much-needed respite. In addition to insomnia, barbiturates have been used to treat anxiety. Much like their role in treating insomnia, they function by slowing brain activity, reducing feelings of nervousness, and helping patients feel more at ease. They were once a go-to treatment for those suffering from acute anxiety. Barbiturates also have a significant role in the field of anesthesia. Certain types of these drugs, such as thiopental and methotrexate, have been used for inducing anesthesia during surgeries. By causing a deep sleep and a loss of consciousness, they allow surgeons to perform operations without the patient feeling pain. However, it's important to note that barbiturates have been largely replaced by safer alternatives in recent years. Benzodiazepines, for instance, have taken over the role of treating insomnia and anxiety due to their lower risk of overdose and dependency. Similarly, propofol has become more commonly used for inducing anesthesia due to its rapid onset and short duration of action. Yet, in certain circumstances, barbiturates still find their place. For instance, phenobarbital is still used in the treatment of certain types of seizures. It's also used in the management of withdrawal symptoms in individuals dependent on certain substances. In conclusion, the role of barbiturates in medicine has been diverse and far-reaching. From treating sleep disorders and anxiety to playing a key role in surgical procedures, these drugs have shaped the practice of medicine in many ways. While their use has declined, barbiturates have left a lasting impact on the field of medicine. Now, let's examine what barbiturates actually do to the human body. These drugs, as you may already know, are central nervous system depressants. They effectively slow down the body's functions, much like putting a brake on a racing car. This can bring about a range of effects, some desired and others not so much. Starting with the desired effects, barbiturates can induce a sense of relaxation that many people find calming. This is especially true for individuals suffering from anxiety disorders, for whom the world can sometimes feel like a non-stop whirlwind. Barbiturates offer them a much-needed reprieve, allowing their minds to slow down and their bodies to unwind. Another desired effect is the promotion of sleepiness. For those who struggle with insomnia, the lure of a peaceful night's sleep can be irresistible. Barbiturates can help by slowing down brain activity to the point where sleep becomes not just a possibility, but a reality. On the flip side, however, barbiturates are not without their drawbacks. One of the most significant is the risk of addiction. Because of the feelings of relaxation and sleepiness they induce, some individuals may find themselves becoming reliant on these drugs to function in their daily lives. This can lead to a cycle of dependency that's tough to break free from. And then there's the risk of overdose. Because barbiturates slow down the body's functions, taking too much can have fatal consequences. An overdose can lead to respiratory depression, a condition where the body's breathing becomes dangerously slow or even stops completely. This can have potentially fatal outcomes. So you see, the effects of barbiturates are a double-edged sword. On one hand, they offer relief for individuals grappling with anxiety or insomnia, but on the other, they carry the risk of addiction and overdose, which can be life-threatening. As with any drug, the effects of barbiturates can be both a blessing and a curse. It's a reminder that while these drugs can offer relief, they must be used responsibly and under a healthcare provider's supervision. Despite their medical uses, barbiturates can be incredibly dangerous. This might come as a surprise considering how we've discussed their therapeutic applications. However, the potential harm they can cause is a significant concern. The main danger associated with barbiturates lies in their addictive nature. Even when used as prescribed, there's a risk of developing a psychological and physical dependence. Over time, the body becomes accustomed to the drug, requiring higher doses to achieve the same effect. This is known as tolerance, and it's a slippery slope towards addiction. Moreover, the withdrawal symptoms from barbiturates are severe and can be life-threatening. They can range from anxiety and restlessness to seizures and delirium. Abruptly stopping the drugs after prolonged use can lead to a condition known as barbiturate withdrawal syndrome, which can be fatal if not properly managed. Another hazard is the risk of overdose. Barbiturates slow down the body's functions, and in large doses, they can slow down vital processes to a dangerous level. Symptoms of overdose can include difficulty breathing, slowed or irregular heartbeat, and even coma. In the worst-case scenario, an overdose can lead to death. These risks are not to be taken lightly. In fact, they were a significant factor in the decline in the use of barbiturates. During the mid-20th century, they were widely prescribed for sleep and anxiety disorders. However, as the dangers became more apparent, their use was scaled back dramatically. Today, they're prescribed sparingly and with great caution, often as a last resort when other treatments have failed. In conclusion, while barbiturates have proven beneficial in some medical situations, their potential for harm is considerable. The risk of addiction and the lethal consequences of an overdose have made them a drug to be handled with extreme caution. The dangers of barbiturates serve as a sobering reminder of the risks associated with any drug. So while they may have their place in medicine, their use must always be carefully managed and monitored. So, what does the future hold for barbiturates? As we delve into the world of tomorrow, Barbiturates, once the darlings of the pharmacological world, now find themselves in a peculiar position. Their use has been on a steady decline over the years, largely due to the development of safer alternatives. Yet, they persist, holding on in certain corners of medicine where their unique properties remain valuable. Let's take a look at the current state of barbiturates in medicine. These drugs, once a go-to solution for a range of conditions from insomnia to anxiety, have been largely replaced by benzodiazepines and other less risky medications. But that doesn't mean they've disappeared altogether. Far from it. In fact, they still have a place in treating certain types of seizures, in anesthesia, and in the management of acute migraines. Their unique ability to depress the central nervous system, while problematic in terms of potential for abuse and overdose, is precisely what makes them effective in these roles. However, the balance between therapeutic use and potential harm is a delicate one. This is why the medical community is in a constant quest for safer, more effective alternatives. The future of barbiturates, then, is an interesting one. With ongoing research and technological advancements, it's entirely plausible that we might see the development of new drugs that can do what barbiturates do, but with fewer risks. Imagine a drug that could provide the same level of sedation for surgery, or the same control over seizures, without the risk of addiction or overdose. It's a tantalizing prospect, and one that researchers are actively pursuing. At the same time, we might also see a resurgence in the use of barbiturates themselves, albeit in a more controlled and focused manner. As our understanding of these drugs deepens, we may find new ways to harness their power while minimizing their dangers. In the end, the future of barbiturates is a story still being written. It's a story of scientific discovery, of weighing benefits and risks, and of the relentless pursuit of better, safer medicines. Only time will tell what the future holds for barbiturates. We've covered a lot of ground today, haven't we? We've journeyed through the fascinating and complex world of barbiturates, a class of drugs that, while they may be less familiar to some, have played a significant role in the world of medicine and beyond. Let's take a moment to reflect on our journey. We began with a look into the origins of barbiturates. The history of these drugs is a compelling tale, filled with scientific discovery, medical advancement, and societal impact. From their early development in the late 19th century, barbiturates have been a source of fascination for researchers and medical professionals alike. We then dove into the numerous uses of barbiturates. These drugs are versatile, to say the least. They've been used as sedatives, as anesthetics, and even as anticonvulsants in the treatment of conditions like epilepsy. They've been a tool for doctors to help their patients manage a range of health issues, proving their worth time and time again. Next, we delved into the effects of barbiturates. We explored how these drugs interact with our bodies, affecting our nervous system and altering our brain function. It's a fascinating process, one that highlights just how powerful these drugs can be. But as we learned, with great power comes great responsibility. This brought us to the dangers of barbiturates. These drugs, while beneficial in many respects, are not without their risks. Overdose, dependency, and withdrawal are all serious concerns when it comes to barbiturate use. It's a sobering reminder that even the most useful tools can be harmful if not handled properly. And finally, we look to the future of barbiturates. While their use has declined in recent years, these drugs are far from obsolete. Researchers continue to explore their potential, looking for new ways to harness their power for the benefit of patients around the world. In wrapping up our exploration of barbiturates, it's important to underscore the significance of understanding these drugs. Whether you're a medical student, a healthcare professional, or simply a curious mind, knowledge about drugs like barbiturates is crucial. It allows us to use these tools effectively and safely, and it empowers us to make informed decisions about our health and well-being. So, as we conclude, let's remember the key takeaway from our journey. Barbiturates, like all drugs, are powerful tools. They have a rich history, a range of uses, profound effects, potential dangers, and an exciting future. Understanding them is crucial to their safe and effective use. Remember, knowledge is power, especially when it comes to understanding the drugs we put into our bodies. Thank you for joining us in this exploration of barbiturates. Until next time, stay curious and keep learning.